Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Welcome to a great show to start off the year 2024 with Dr. Mark Vaughn and Dr. Gwen Vaughn, bringing you medical information. But we don't have a medical topic for today's show. But we'll still talk about your comments and questions.
Yeah.
Because we've already got comments. We've got
New year, new you.
I guess I should put
Maybe.
them up, shouldn't I?
Know.
New year, new you.
I don't know.
That would be great. We should do that. Part of my new me is, trying to learn guitar. So, yeah.
Right.
How about new you?
I'm not one to make resolutions.
Okay.
So this is going to be kind of a big year. My oldest is going to be going into high school, and
that's 9 months away or 8 months away?
Yeah, August or
Okay.
So that's a big thing.
Revving up for that? Yeah, that's a new life. That's exciting.
Yeah.
Yeah, it's something to look forward to. So let's get to your comments and questions here. We have on the chat, on the Ninja chat here. Let's see who we're. Well, first of all, Bianca, who of course is one of our regulars, clapping hands for the show.
Yeah,
Laura Barzyk, hello.
Gone for 2 weeks.
Yeah, so thank you for welcoming us back. Lindsay, I'm afraid it's still the same terrible. Oh,
that's so sad.
I'm
sorry, we put that back up.
Okay.
Put that on the screen.
Yeah, Ryan Marchand. Well, hello. Glad to see you again.
Hello.
We're glad to see you too.
Top of course, of the day to you.
I guess I should say the reason that we were gone for, was it 2 shows?
2 shows in a row.
Because the office was closed.
Yeah, that was
Christmas.
Monday was Christmas. Monday was New Year's.
Yeah, so
we weren't working.
There's a reason. We were with our families.
We are.
We hope you were with yours.
Yeah, we are family practice doctors where we take weekends and holidays off.
That's right. Angela's saying hi. Hi, Angela. Thank you for being a part of the show.
Yeah.
There are some things in the news related to healthcare. We really, I don't feel qualified at this point to make a whole lot of comment on what we were talking about this morning, so maybe we'll try not to bring that subject.
Okay.
But certainly, we just had a positive COVID this morning. I know right before the end of the year, we were having positive everything.
RSV.
COVID, RSV, influenza. They
had a little boy who had RSV and strep.
Yeah. Another thing we discovered
was family.
RSV lasts a long time.
Yes, it is a longer viral illness.
If you're RSV positive, don't be surprised. Well, a couple things. One, don't be surprised if it's still going on 2 weeks later.
Yeah, it hangs on.
And you're still contagious, too. Mm-hmm. Contagious for a longer period than typical influenza and COVID. Right. So in that respect, it's worse. And then it can be just simply upper respiratory symptoms, like a head cold. It can be like a head cold, RSV. So bad to babies.
For adults, it commonly is just like a cold type syndrome. It's the really young, like the babies that it can go down in the lungs and give you a condition called bronchiolitis, which can impair breathing. Just the airways get so swollen. So,
and look at this. Look,
I'm looking at. Oh no!
Lindsay Antwine had RSV Christmas week, and it may still be hanging on.
That would be horrible. Yeah. RSV is a miserable disease.
Lindsay, so sorry.
Yeah.
And that one we don't have a specific antidote for, like we do for influenza.
No. We do have a vaccine for those who are 60 and older. That would not be you. But if you are 60 and older, I encourage you to get it. Try to slow that spread. Because it actually is older individuals where it can be bad as well, even deadly in some cases. So,
and then also, Jeanette Lakes saying hi and asking if we can chat about Vertigo. And that's absolutely,
Vertigo.
This is the show to ask for a topic that we're not bringing up.
You came to the right one.
So Jeanette,
you're going to talk about Vertigo.
Let me see what else is going on coming up here. And I think that would be appropriate. So
Vertigo.
Jeanette, I'm going to leave your comment up there as we begin the discussion. Vertigo. First
differentiating.
First to define vertigo, subjective sensation of motion, of movement. That can be either of yourself, or of your surroundings. Classically, it's associated with nystagmus, the eye
eyes kind of beating
jerking
back and forth.
And what you experience subjectively when that's happening is what you're seeing in your vision is moving like this.
Yep.
I like to relate it to a happy childhood memory of playing on, some of us might remember the merry-go-round. Very heavy, made out of stamped steel metal with these metal bars.
The one at Forest Lake?
That one. Oh
totally,
my goodness, that one. So these are just, it's injury marked.
Oh my goodness, kids flying off because you got these dads just throwing it.
The dads. Sticking your head and getting hit by the bar.
Oh man,
hitting your hand.
I've got memories of that one too.
Around.
When our church would have their annual picnic thing. Oh man, I don't think we had a year where a kid wasn't injured. But it was. Anyways, that'll make you dizzy. Oh my goodness, I thought as you get older, you get a little more sensitive to those things. Oh my goodness, I can't imagine doing that now. I would be so sick. It would take me out for a day, I'm sure.
There was always that kid that would find his way to the middle of it.
Yeah, he's just
and just kind of brace himself in and not throw up, but be in the middle.
Yeah.
And then so vertigo. That's the actual definition of vertigo, is that subjective sensation. So unless you were going to jump in, I was going to say.
Oh, I was just going to say. So people often come in with this. They say I'm dizzy, and dizzy can be vertiginous or vertigo, or it can be lightheadedness. So it's important to differentiate between the two. Because lightheadedness is different. Wow, I was caught on.
There's
video.
chocolate and caramel in the bottom.
Yeah, there is.
Wait, did I say that out loud?
So it's good to differentiate between the two, and specifically we're talking about vertigo, or that sensation of moving off and describe this.
Are you going to finish this?
Absolutely, I am. Don't touch mine. So that's vertigo. Vertigo. What causes vertigo?
Well, I was going to say there's two
different
flavors. There's central and peripheral.
Yeah. That's probably a good place to start as well.
Central and peripheral. Central referring to the central nervous system, essentially the brain.
Yeah.
And peripheral referring to, kind of the balance organs of the inner ear.
Right.
When we say inner ear, we don't mean you have three ears, left, right, and inner. What we mean is the more towards the middle of the head part of both of the ears, in case there's any confusion there. So that would be where peripheral, because it's not in the brain, it's more out toward the outside, the ear. So you get it.
Those organs outside of the brain.
So typically, central is bad.
Yeah.
But
something going on with the brain. Usually a subtle vertigo that unfortunately progressively gets worse. So it comes on slowly, and then each day, week, it's worsening and it's worsening.
And then peripheral is typically
comes on quick and
not
hard,
bad,
but
severe. Intense.
Yeah.
Throwing up, like falling down, throwing up. That's how intense peripheral vertigo can just hit you. Sometimes with something as simple as turning over in bed. That's a very common trigger that we hear of for peripheral vertigo.
Mm-hmm. Yeah. I guess we differentiated those. There are ways to differentiate the two. We do have some tests. If we do think it's a central cause, we'll actually get a scan of your brain to see if something's going on there. And this is looking for something going on in that area of the brain that has to do with position sense. Tire swings, yeah. Ryan.
Spinning.
Gotcha. Yeah, we all did. Or the classic one where you're turning around on the baseball bat, and then you got to run and do something. Did you ever do that one? Have a competition where you're both turning around on baseball bat?
Are you sure there wasn't an adult?
And then you try to run straight, and you're just like, what?
Did kids come up with that, or did some adult say this is a thing we're going to do as an activity?
Oh, I'm sure it was an adult thing to make to laugh at little kids, or adults who are maybe not sober.
Yeah, not sober. We're not saying what they are. We're just saying it's not sober.
Interestingly, that will cause nystagmus too.
Speaking of falling, sobriety.
Speaking of sobriety. What a great transition.
We have these tables, motorized exam tables that will go up into the air, which is appropriate when you're trying to examine a patient and you need them at a certain level, like you're sitting on a stool and you're doing, say, a pelvic exam or some other exam or operating, whatever. And so they can go quite high. You know, if we're sitting like this, that's pretty high for a person to be lying on a table.
Tall.
So I am always sure to tell patients, because that makes you a little nervous if you're going way up that high.
Yeah.
And half your body is hanging off.
Don't jump off
one end of the table. I'm always sure to let them know that we've never had a patient fall off who was sober.
That's true. Yeah.
They always appreciate that. Helps them relax a little bit during a tense exam. So that I'm sorry, go ahead. I just want to show you
that was like when I
Ryan's
told my
comment
patient
there.
today when I was giving her a knee injection, hey, if I do this correctly, it won't hurt me one bit.
I'm sure they really appreciate that one. Yeah.
Anyways, 2 delicious flavors of Vertigo. Central and peripheral.
So
serve it up.
Maybe we should jump right into this Bianca. I believe this is Bianca Dye has a comment there.
Oh, yeah.
About the exercise. I believe she's
Right.
talking about the epilepsy.
So you're talking about a very specific type of vertigo there. So when we're talking about that peripheral vertigo, that can be caused by a number of things. And probably the most common is a condition called benign paroxysmal peripheral vertigo, BPPV.
A lot of words to have to explain. Well, we already talked about vertigo.
Benign, not dangerous, not central, not cancer. Benign.
Or stroke.
Paroxysmal. Paroxysmal means that it comes on quickly, suddenly. Paroxysms are very quick and sudden.
That resolve.
Peripheral, as we explained earlier, it's not central. It's the outer or that inner ear, which is the outer of the brain, outside of the brain. And then vertigo, BPPV. Yeah. Worked it out there. So the reason this happens is rocks in your head.
Otoliths. Ear rock. Otolith.
Yes, yeah. So little otoliths. Yeah, little calcium. These are extremely small.
Microscopic.
Yeah.
Little
rocks. Pebbles, rocks.
Calcifications.
Calcifications. Calling them
Crystals.
rocks is kind of a misnomer for sure. But yeah, these roll around and give us our position sense. And so typically, if I close my eyes and turn my head to the left, I know it's there because I can feel that. And
these specifically are for rotary motion.
Yeah. I'm just giving examples here. But yes, you're right. Yeah, for rotary. Yeah, so
there's 3 of them.
Yeah.
In different orientations.
In different, three different dimensions.
Yeah.
What? Crazy. Anyways, so I can kind of move my head around and I know where it's at when my eyes are closed because of this sensation that I get. You have 2 of those, one on each side, and those are constantly giving information to your brain about where your head's moving. If one of those little otoliths gets out of position and starts, how these works, as they roll along, they stimulate little hairs.
I'm going to have to find a graphic.
Yeah, okay, you try to find it. They roll around and stimulate these little hairs, and then those hairs send a signal to your brain letting you know where those are at, which then tell you where your head's at. Okay, there we go.
Whoa, that was cool.
We're back. So if...
There's a way to do this.
There's apparently a way to cut me off when I'm trying to talk
Sorry.
here. So if one of those little otoliths gets out of position and starts stimulating a hair that does not correspond with the hairs on the other side, you're getting differing signals. And your brain is still interpreting that data. And your brain says, hey, the only way that I would be getting this signal would be if I was spinning really, really fast, because then things would be going different ways in your head, right?
That's about right.
About right. That's how I explain it. So there you go.
I don't know.
None of those are great.
None of these are great, and
semicircular canals.
Yeah. So I always like
it's
to
hard to
explain
to
it.
see them now.
Imagine. It's actually not a flat surface. It's on the inside of a tube that's a semicircle. But lining the tube, we'll think of it as flat, and a bunch of hair-like structures growing out of the flat, although it's actually a circle, with a rock on the end of it. And if there's motion, the fluid that it's in kind of holds the fluid. the fluid stays where it is while the body moves around it.
Perfect.
And the
If
little
you've
rocks
ever
get moved by the
had
fluid.
like a little thing of water, when you turn that, the water stays the same, but it's going to be touching a different part of that little basin.
Anyway, you can lose one of these rocks.
Yeah.
It wreaks havoc. Swoosh. Well, it becomes dislodged, swishing around. And I don't know if this is actually known, but it's the model I was taught.
This is the model I was taught too, and yes.
But I don't know if anybody actually knows this.
Yeah.
It's just a good explanation for us.
They've taken apart.
model.
They've looked at semicircular canals under the microscope, and they know it has all of these components that we're talking about.
So you imagine if one of the rocks gets loose and starts smashing into all the other ones that are still attached to their stock, it's going to be wreaking havoc and sending false signals of movement.
Yeah. Essentially. Especially when you...
that don't match the other side.
Yeah. So when you move a certain way,
the
other side is going to move, and you're going to get mismatched signals.
Yeah.
So especially in certain motion. So there are some maneuvers we can do to figure that out. They unfortunately make people really sick, but they can be very helpful.
And although we were calling it benign, Laura Barzyk points out that
you can fall from it.
Yeah, it can lead to something bad.
Yeah. It in itself is not dangerous. However, if you fall and break a hip from it, that's not good. So I'm
not sure. Interoception.
I don't know what you're meaning by that.
If you spell it with an E, I know it would be.
Susception? Intussusception?
No. Well,
because that's a thing too.
You can see that with interoception. But okay, let's get back. And poor Jeanette Lakes, too.
Yes. 5 times in the past year should I fall. Well, we're always going to tell you to check with your doctor because we can't be there to examine you or check you out.
Yeah.
And this is not medical advice. This is for
Actually, I don't even care to.
Entertainment purposes.
At this point in my career.
You don't even care to what? Give advice?
To help them.
Wow, man.
Wow. Okay. The caffeine loosened my tongue.
at least I have made sure we're not going to get sued.
No, that's guarding against it.
I guess so. If you're not,
right.
Yeah, we're not diagnosing
that's
anything.
What I'm saying.
We were just talking about the most common type, but it could always be something else. You should always get checked out.
Are you going to get uninhibited the more caffeine?
I'm getting there.
Okay. So that's Jeanette. Yeah. And,
for long, I'll be dropping F-bombs.
What I'm noticing here left and right.
Fantastic.
There's the first one. That's really funny. So Jeanette points out to us that the demographic of our audience is people who get vertigo.
Oh.
Yeah.
Look at that.
That's really interesting here, which I'm sorry for, because I know
vertigo.
I hate
vertigo. Can be miserable because often it is combined with getting sick, feeling upset stomach, nauseous.
Actually,
yeah.
Well, you saw me with it. I went home that day.
Oh yeah.
That was miserable.
Well, yeah.
Okay, so Bianca talks about these exercises.
Exercises.
What's she talking about there?
Yeah, so this is specifically for that benign positional vertigo that we talked about, but there are maneuvers that you can do to try to dislodge and recalibrate, as it were, try to get that little otolith back into position.
And as a disclaimer, if the exercises work, it doesn't guarantee you don't have something bad.
Absolutely. Yeah.
Unless you come into the office and pay to be seen by us, and then we'll say that.
And then I'll tell you.
When we're on video...
Yes. So
we're not giving you a final answer.
No. You should always confirm that with your doctor, your trusted primary care doctor. But those maneuvers are called the Epley maneuver. It's a specific maneuver, but you can do left or right, depending on when you get dizzy.
Yeah, and you can look them up online.
It'd be really bad if I got dizzy every time I looked right today.
You've been looking at me a lot.
Yeah.
You've been looking at me with that eye. I know that look. I'm married. So.
My eyes are up here.
Anyways.
Anyways.
Yeah, let me. Okay, I think we're getting.
Did we answer the questions?
I'm trying to decide if those little purple. I need glasses because I can't tell if that's an eggplant.
It's
it's
just a purple round thing.
The guy on the
Crying
insurance commercial says,
excessively. Don't talk about eggplants.
says it may look like fruit, but it's not. Okay, Hilda, we don't know.
The guy on the insurance commercials? I don't get that insurance commercial.
The guy who's trying to teach the people who are turning into their parents and how to text.
Yeah.
And somebody got a bunch of eggplant emojis, and he says, it may look like fruit, but it's...
when you're texting it.
Here's something interesting.
It's a laughing face.
Here's a bunch of letters.
It's a laughing emoji.
Bianca's asking about NAFLD. What's that?
NAFLD.
Non-alcoholic?
National Athletic Football League Development.
Division.
Boom.
It's division.
Oh, division.
Non-alcoholic, something
fatty liver disease.
Yeah. There it is. And we sometimes find that with an ultrasound of somebody's liver.
Yeah, it's often found incidentally, meaning you are looking for something else, and then this comes up. Rarely we'll go looking for it because somebody has slightly elevated liver enzymes, the AST and ALT, which this can cause.
And we want to scare them into stopping drinking.
That's usually, what we're trying to do. Now, but this is non-alcoholic fatty liver disease, so it kind of comes up random. Now, what can it be caused or due to? Not alcohol, as the name implies, non-alcoholic.
But as the name also implies, fatty.
It's fatty liver disease.
Yeah.
So
high fat content.
Excess outer fat can give you excess inner fat.
Yeah. Yeah. So we try to get people to reduce fat intake.
Yeah. Lose some weight.
And
that can help.
And they both can lead to very bad disease of the liver.
Yeah. It can happen in people who are not overweight as well.
It can.
It's not as common. There are some familial cases of this, as is mentioned there. But yeah, it's one of those where the biggest thing is losing a little weight to help out with that. Don't drink alcohol. Don't do things that would be hard on your liver.
Hilda has a request. She wants us to talk about Paxlovid drug interactions.
There's a lot.
So the most common one I come across, most common because they're very common drugs in our practice, would be statins.
Statins are common.
And anticoagulants.
Yes.
And we actually do tell people to stop those during the 5 days that they take their Paxlovid.
Yeah. So in some cases, when you can't stop, your statin you can usually just about always stop. But for some of those anticoagulants, you can't stop it. So that's something that sometimes you got to say, okay, Paxlovid is... Some people. Yeah, it's pretty rare. But some people, other thing, actually, the case that I had recently where we couldn't give Paxlovid was some of the heart medications, specifically antiarrhythmics. They interact, and I am not going to stop somebody from their antiarrhythmic. That is a cardiologist decision. So I had them contact their cardiologist before we even made a decision.
And really, how many... So Paxlovid doesn't get people over COVID quicker. It doesn't do anything for somebody that doesn't have some serious comorbidities under age 50. Does nothing.
And is recommended.
Don't ask
as a result.
I don't get it when I get COVID. I don't. Twice I've purposely
take it.
Either purposely not gotten COVID or it didn't even come to mind to use it.
You purposely did not get COVID. That's my goal every day.
I purposely did not
get COVID.
Use Paxlovid.
Yeah, I know.
The words are similar.
They are very similar.
So people over 50 and usually much older, people with serious disease, comorbid illness, chronic illness, it keeps them out of the hospital more and keeps them from dying more. But how often are we having a patient either get hospitalized or die from COVID these days?
Pretty rare.
When's the last time you
happening, according to the numbers we see, but I can't think, I have not had a patient recently.
So if you have one of those drug interactions, you're probably playing the numbers to not even use the Paxlovid. Most people.
Yeah.
A doctor probably should talk to each patient who's making this decision and go through it with them. But
high risk, those who are older, definitely 80 and older would be in that category. That maybe it would be helpful. Those with high risk conditions.
And a lot of the
Consider it.
interactions, if you read them, you'll go, you know what? That is really a nothing burger, so go ahead and take it.
True.
That is true for a lot of the interactions we read, but each one has to be looked at individually and talked about.
Yep.
And I would say that's one of those, what's it called? Shared decision making?
Shared decision, case by case
Decisions should
basis.
be made
Yep.
with the patient and the doctor, both looking at the situation and deciding. And I would not give an across-the-board recommendation for something like that.
Okay. Yeah.
Which I just did. So that's Paxlovid drug interactions for ill devour. And then, middle ear infection, that can cause.
Oh, yeah.
That can certainly
Infectious, there can be infectious causes
vertigo.
of vertigo, for sure.
Yeah.
Labyrinthitis, as it's called, where the infection goes into the inner ear.
Hilda bringing in exactly what we're talking about, Xarelto.
Oh.
And Paxlovid. My hubby, is that 62 or 82? 62. 62 on Xarelto, has Paxlovid, but decided not to take it. And chances are he's going to be fine.
Yeah.
Yeah, don't lose sleep over it.
Yep. Over-the-counter medications.
And Jeanette so nicely says, thank you guys, Happy New Year from Ireland, with a big green background for her J there. Thank you, Jeanette Lakes. Just watching an Irish movie last night. Once, maybe you know it. Takes place in Dublin. Okay.
I don't know.
Made by the same guy that made Sing Street.
Okay.
I don't know if you know Sing Street or not.
Nope.
It's fun. It's a lot of fun. If you like musical movies, it's a lot of fun. Okay. So that kind of brings us to the end of our first show of 2024. Thank you for joining us.
Yeah.
You are a wonderful, look at currently 27 viewers. There'll be a lot more after we close it and the people watching it. And we'll say it's about Vertigo. I'll go back and change the title.
Come learn about Vertigo.
So if you want to follow us on the socials, we got them right here. There is another one that's not listed here where it says Dr. Vaughn. There's actually an Instagram also called Mark Makes Sounds, no spaces. And if you want to watch videos of me singing covers of Johnny Cash. Actually, there's just one.
That was pretty good. I enjoyed it.
Well, that's very nice of you to say. Thank you. So that's out there in case that's something that's of interest to you. Until next time.
Hey, I'm Dr. Dwayne Vaughn.
And I'm Dr. Mark Vaughn telling you to stay in good health.